Though in most cases they are forgotten or sidelined, journalists like healthcare workers are on the front line facing serious health risks on a daily basis as they pursue crucial stories on the COVID-19 pandemic. The risk is real as some end up being infected while trying to collect reliable and verified information. Freelance journalist Kudzai Madzivire is among the growing number of journalists who have contracted the virus in the line of duty.
I was very scared because in as much as a lot of things have been peddled on social media in terms of people who are dying, I started thinking that I might lose the battle to COVID. But I ended up in hospital because I'm someone who has underlying health conditions. I am a diabetic, I'm on insulin. Plus, I also started developing respiratory complications.
African News Agency reporter Jonisai Maromo, who is recovering from the virus, reckons being a journalist is among the toughest jobs in the face of a pandemic of this magnitude.
In the last week, before I got infected, I was covering different protests which were happening in Pretoria. And at those protests, you don't know who is coming in and what they suffer from. We go in there to do the work, but at the end of the day, we get exposed to too many things that we don't know of.
After spending a week in hospital, Kudzai admits the road to recovery has not been easy.
COVID is a disease that needs someone to be strong personally, to have that will to survive. It needs collective effort. It needs you and me to be collectively working so that we can be able to be handling COVID.
Kudzai might have recovered from the virus, but the Budiro 3 community still shuns him.
Whenever I get out of the house, people start pointing at me. Some actually call me a journalist with COVID.
Representative unions are of the view that journalists should be treated as frontliners and get the necessary support from stakeholders.
We continue to call on authorities and anyone out there, corporate sector, everybody, that whenever they make those donations, they should remember and ensure that journalists are remembered and are part of that action. Otherwise, our fight against COVID-19 will amount to nothing if we leave a critical sector unprotected.
There is need, obviously, to risk assess staff and ensure that staff at risk minimize exposure to potentially crowded interviews or even entering spaces, public spaces, where they can then be put at risk. Also, most important is the use of virtual technologies starting at government level.
I do not think there is much our employers can do for us to avoid being infected. What the employer can do is to be more active when we get infected by providing us the medical care, because surely COVID can be beaten, because right now I'm talking in terms of I've survived.
According to the Geneva-based Press Emblem campaign, a total of 186 journalists have succumbed to COVID-19 across the globe. Abigail Tembo, ZBC News, Harare.